Good morning, this is Dr. Beck. It is August the 5th of 2021, and I'm going to give you my daily update and tell you some things that will help you out with some of the things going around here. Okay, so the first thing I want to talk to you about is the housekeeping thing. Every time we give somebody an order to outside of this facility to another facility, whether it's for an imaging issue or a test or a consult or referral to another doctor or anything, we say all the time, we send our paperwork to them, okay, but you've got to call and make the appointment. And I'm trying to convey this to everybody. You have to take control a little bit of what's going on here and make the phone calls. People are consistently waiting for the facility to call them, and nobody is calling and setting up appointments with anybody for anything. Okay, and this is across the board with hospitals, labs, imaging centers, other doctors' offices, specialist offices, the big hospitals, little hospitals. Nobody is calling the patient to set up an appointment. Now, I don't like this. This is somewhat new, I think. In other words, before COVID, I think we could send a referral, and the facility would reach out to the patient and get them all set up. Certainly, if somebody told me you needed to be seen or wanted me to see you, another doctor or anything, I'd be calling you, I promise. But that's not what's going on right now. So if we give you an order for anything, okay, you've got to call the facility. The number is on there, and we give that to you on purpose so you can schedule your time to go with them. We don't mind calling, but we also don't want to waste a bunch of time calling and setting you up an appointment, and then you coming back to us and saying you can't make that time, and then you got to call them back anyway, and there's just too much going on. The best thing for you to do is to call them and set up the appointment. We also give you the order, and we give you the order on purpose because many facilities across the board don't get the orders. They don't have a system to recognize the orders. I don't understand all that going on, but we send out hundreds of orders every day to different facilities and everything, and we have to reiterate that. So just something to think about. Do that for us. Make sure you get what you need when we order it just as well as we do. All right. As far as COVID-19, there's 1,640 cases. That's 9 up from yesterday. We're definitely in that spike that I was talking about. I definitely want people to social distance. I think you should wear a mask if you can. I think if you're using go to the gas station and get gas, or you're going into any public place, it doesn't matter which one it is, you should use hand sanitizer. Try to keep your fingers out of your mouth and your eyes. If you're having symptoms, okay, upper respiratory symptoms, you really need to get tested for COVID because it is here in the community. And we have a protocol set up. So if you need medical care, you want us to be involved with your COVID experience, you can call us and we'll set you up a telemedicine appointment, and we still got the drive-through going around there so you can get tested through the drive-through. Now, as far as the drive-through goes, we're still running the drive-through. You can get a rapid test. Now, the rapid tests are not covered by insurance. They're just as valid as anything else, and they cost $80. And we have to get some information from you because the CDC, we have to report this to Department of Health, the results of the test. So anyway, it's open, it's $80, and we'll do the rapid nasal test. If you're a patient of ours and you want a test done, we can do the nasal test, and we can even do it after the rapid for confirmation. But you have to be a patient here to be able to do that because of the information that we have to provide the Department of Health. We have to already get it, and that's a lot of information. Okay, I talked about our new services. I've got staff that are at home because they can't be here because of illness, and I have them calling, reaching out to patients 45 and older to talk to about this new services and to determine whether or not you're up to date with your mammogram and your bone density, and some of the other things we're offering. They tell me that nobody answers the phone, and I get that. However, if you would kindly answer the phone today, I've got people calling. I know that's a problem. Nobody answers the phone when I call. I have to call multiple times. So please just be aware that we are reaching out to you. And then last but not least, I am humbled by the outpouring of support for Place of Hope. We had our meeting last night, and it's humbling. That's all I can say, and it's a great organization. And I think we were helping a kid last night, and we're reaching out and finding any of these kids that need help, and we're helping them, and that is a beautiful thing. So thank you in advance, and thank everybody who's supported us. I've seen just it's like I say, it's just a humbling experience, and I really appreciate it. And hopefully this will be transferred to help children at the most vulnerable time of their lives. Alrighty, if you need us, give us a call, okay? We're short-staffed, but we're not too short-staffed to take care of your issues, and we're doing okay. We're surviving the issue, and hopefully everybody will be back to work next week. Have a great day.